Low back pain is one of the top 5 most common reasons for people visiting their GPs. About 80% of the population will be affected with low back pain at least once in their lifetime, with some people having it more recurring than others. Some studies have also estimated that about 25% of the world's adult population lives with chronic back pain. There are different types of low back pain that may present with or without associated leg pain, with the most common being one that's termed non-specific low back pain, which is pain that has no specific or known cause or condition. Often, when you present with low back pain, it will usually resolve by itself within about a 6 to 12 week period, and any pain that lasts more than 12 weeks will be classed as chronic low back pain. A lot of people develop serious concerns when they present with low back pain because it's so close to the spinal cord. But the good news is, most cases of low back pain are rarely serious. In fact, only about 1% of all back pain cases are serious. When I say serious, I mean things like cancer, severe neurological issues, unstable fractures, and all those things, for example. Please rest assured it's not uncommon to have pain that persists for several months. But then what we then see is people start to worry that there's something serious going on. So they want x-rays and MRIs and things like that, which doctors don't always get. But MRIs are the gold standard for imaging, but they're so good that it's actually been found that roughly 50% of people aged over 40 will have a positive finding of something on their MRI. It could be a disc herniation or wear and tear or degenerative changes, that sort of thing. So what I tend to tell people is don't worry too much about the results on your MRI, because the likelihood is that lots of pain-free people will also present with similar looking spines of those people who have had issues on their MRI. So in fact, the use of diagnostic imaging, especially in the first month, is actually not recommended, which is why when you go to your GP with your concerns, expecting them to refer you for a scan or to do something about your pain, they'll often turn you away with some generic advice or some painkillers and some exercise sheets. So diagnostic management is only really useful if low back pain doesn't respond to recommended protocols and the management of the condition needs to be changed or a more serious pathology is suspected. So the worst thing you can do is overthink your pain and feel like you might be damaging your spine even further. So what you then do is you become overly cautious and then you limit what you like doing. So things like lifting, twisting, bending, which will result in a gradual weakness, stiffening, and it will even impact your mood as well. And before you know it, you find that you would have conditioned your nervous system to anticipate pain, which ironically makes you more prone to pain from things that wouldn't be ordinarily painful to you. So this is what is called as central sensitization, which in my humble opinion is the worst place to be, because it is so difficult to treat people once they reach this level. Difficult, but not impossible. So try not to overthink your pain. Now, what you will find is that no one really gives you a diagnosis of what exactly might be causing your pain, which I can appreciate can be frustrating at times. But the reason for this is that at the moment, we don't actually have the ability to pinpoint the exact cause, nor is it really necessary to successfully treat your pain. Okay, so now you're thinking, all right then Aubrey, but how do I actually manage my low back pain? So the initial management is always advised to try and get on with your normal day-to-day activities as much as your pain allows. So yes, you're gonna be in pain, but try to do what you can. So don't completely stop. So if you work, try to carry on going to work. If you work out, try to continue doing your workouts. You may not be able to do certain movements as well, but encouraging early activity, even just a little bit, is far more helpful to your recovery than not doing anything at all. Then the next thing is you can try and do some self-massage. So if you have somebody at home, that's even better. Lots of people find the massage guns quite helpful, and they're becoming cheaper and cheaper, which makes them more accessible as well. So that's just short-term relief. It's not gonna get rid of your pain completely. Superficial heat as well can help. So heat packs, warm weather, warm showers, warm baths, whatever your preference is, can help to relax the muscles. On the other hand, even cold would be helpful as well. Structured and targeted exercise looking at spinal mobility are fantastic. That's because the focus on core stability, which I know is a buzzword, but it's still important when we're looking after our backs. And now there's even more and more evidence and work that's showing that breathing work on its own is also quite effective in treating low back pain, but combine it. So some people can also self-click themselves, which can have a temporary nice pain relieving effect. But if you have things like osteoporosis or osteopenia, then I would advise you to seek some professional advice before you try any self-mobilization or watch some YouTube videos and try and do it by yourself. Of course, if you want professional input, you can also see a physio, chiropractors as well, or osteopaths. All these people can do manual therapy, manipulations, acupuncture, and so on that you might find helpful. But my number one tip for low back pain is that prevention is always better than a cure. So instead of trying to treat your symptoms, if or when you have back pain, it's better to lead a healthy lifestyle, an active lifestyle that will promote healthy weight, regular exercise, a balanced diet, maintaining good workstation ergonomics if you have a desk job, making sure you're carrying out good manual handling and lifting techniques if you have a practical job or do anything practical outside your normal time. All these things can have a positive impact on managing your pain as well, and ultimately preventing you from developing back pain or at least mitigating it. Other things you can do is try and take regular breaks, avoid prolonged sitting or standing. So yes, there are correlations with poor posture and back pain, but I'm not too worried about what type of posture you have as long as you regularly move and change position. So poor posture is mostly a time problem as opposed to a position problem. The longer you spend time in any one position, the more likely you are to get some discomfort or pain. So make sure you're changing your positions frequently to avoid putting excessive strain on your back. I hope that makes sense. What I would say is don't bother too much with things like lumbar support belts to manage your back pain or special insoles for your shoes, as sometimes these can actually have a negative impact on your pain instead of actually helping. I'd also say maybe save your money if you want to purchase a fancy mattress that claims to stop your back pain, because really there's limited and sometimes no evidence for these claims that some companies put out. But obviously a normal, reasonably comfortable mattress is better than an old worn out one. The same goes for a fancy orthopedic chair, for office chairs. They may be more comfortable for a slightly longer period than your standard office chair, but they won't cure your back pain. Again, what's important is developing those prevention habits that I just mentioned. So these are just some generic exercises I like to give out that may or may not work for you, but just so that you can see and have an idea. This first one, you're laying down flat and really you're just trying to peel off your back slowly as in a segment from the bottom and just going up and then laying it back down. It's good for some control. And then this one is almost like a 4-point kneel, but really your knees are not touching the ground, arms are shoulder width apart, and you're just trying to curl your bottom and arch your back. If you can't do it, you can do it on your knees like on here. And then this one, I like to give this one out quite a lot actually. This is called a QL stretch. So you're just laying on your side, you're just sitting down, legs crossed, and you're just applying pressure on the knee, leaning between sides, and that should give you a nice solid stretch. And then just finally, again, hugging each knee, you take your right leg, give it a hug close to your chest, and then same on the other side. And then of course you want to double it up as well and just hug your chest and hold for a little bit.